that we stand, try and touch the wall with your back.
Yeah, I'll hold your hand. Okay, back up against the wall. Back up against the wall.
Good job. Now stand really tall.
Here, Bria, I want you to stand up so I can help Audrey.
Right.
There we go. Perfect.
Good
Stand
job.
tall. Look at mommy. So where are her feet, Cassie?
Years ago, as I said, there wasn't an internship program in the north. So what we were seeing is we were hiring in Northern Ontario new grads, predominantly from New Brunswick and out of province, some from Southern Ontario. And these folks just wouldn't stay in the positions any length of time. They'd get a year in and then they'd leave. So we had this constant turnover. NODIP has filled that gap. And in particular, it's filled that gap in public health. Now we actually have full capacity in the 7 Northern Ontario health units. We're seeing dietitians stay in the north in public health, and as a result, we're seeing actually a really strong community of practice where recent NODIP intern grads are actually becoming preceptors for new interns and new graduates themselves in public health and in all other settings as well.
Registered dietitian is a nutrition expert. They work in a variety of different practice settings. A registered dietitian becomes a registered dietitian first by completing an accredited university degree in science, in human nutrition, and then they must complete either an accredited master's degree or a dietetic internship, and then write a licensing exam. If you pass, you become a registered dietitian. An internship will be a combination of different placements in a variety of practice settings, so things like clinical settings, which could be hospitals, community centers, chronic care centers, public health or community placements, and food service placements. There's usually also a research component to a dietetic internship.
If we are graduating health professionals who think, oh, I'm all done my course, now I'm going to work as a health professional, and they never have to do research again or evaluation again, then we've set ourselves up for failure because we're constantly generating new evidence to come up with better clinical practice guidelines, better ways to serve the public good. We're hoping that our dietitians, through our good training in the NODIP program, can actually walk away with the core skills that they need to ask every day, am I doing this the right way? Is there a better way to do it? Am I making a difference in patients' and communities' lives?
I grew up in Elmira, Ontario, close to Waterloo, and then I did my undergrad at University of Guelph. One reason why I chose the NODIP program was the focus on rural health. Growing up in a more rural community in Southern Ontario, I was somewhat intrigued by this unique aspect of the program. Having a sense of adventure, I was excited to explore a new area of Ontario, so that was one of the factors in choosing NODIP. Little did I know that I would come to love the North and call Sudbury my home. Here is the sugar, okay? So 4 grams, very low, right? Anything under 10 is quite low for yogurt.
Yeah.
So if you want to see what it's sweetened with, it's at the bottom. So sucralose, that's the same sweetener that's in Splenda.
Oh, okay, okay.
And that's all it uses. So yeah, so that's a good option for someone with diabetes.
Okay, because I buy the snack ones, eh? So that's good, eh?
Yeah.
Okay.
That's a good option.
Yeah.
There's definitely a challenge for healthy food access in many communities, and so really working at developing workshops that can teach people how to prepare healthy foods on a budget. There's issues of lack of transportation or environmental contaminations, lots of factors that play a role in people's ability to make healthy food choices. I see my role as helping to overcome some of these barriers and find creative solutions and alternatives to make healthy food more accessible. The internship provided the necessary experience needed to start my work as a sole dietitian in this setting. I've had the opportunity to be involved in a number of cultural events such as powwows or traditional feasts. Those are always really great experiences and a good way to meet the community and meet new people. Without the internship, I would not have had the confidence to work in an effective manner.
I wanted to work in acute care probably before I was even finished my university degree. In university, because it's an accredited program, we're introduced to many different areas of dietetics through this program. My most favorite parts of university were things like calculating tube feeds and TPNs, which is what I do on a daily basis now. Most of this work is done in a hospital, so that's definitely why I was interested in working in a hospital. The TPN stands for Total Parenteral Nutrition, and I guess the more general term would be parenteral nutrition. Basically, the way I explain it to my patients is that I'm feeding them through their vein. So we're bypassing the gut altogether for a variety of reasons. For one reason or another, their gut isn't working properly, and we need to provide them with nutrition without using the gut. Things that I would calculate in this are their total energy requirements, their protein, carbohydrate, and fat requirements, and then it gets a little bit more specific looking at things like electrolytes, trace elements and minerals, as well as vitamins. The patient's status really impacts how I determine this TPN or parenteral nutrition prescription. So what their energy needs are could really have to do with how sick they are, what kind of conditions are keeping them in the hospital, and day-to-day things are also going to change. So their status day-to-day I may change these prescriptions as they move along in their hospital course. During my internship, actually, I had a lot of opportunity to learn about other professions and what their scope of practice is. This allows all of us to be experts in our own area and also complement each other's skills. For example, in the hospital, dietitians work frequently with speech-language pathologists. In acute care, a large part of the speech-language pathologist's job is on swallowing, and the dietitians can help by working with the patients on modified diets related to their swallowing, with education, providing food items that they like, and sometimes when dysphagia is really severe, initiating things like nutrition support.
One of the sort of fundamental pearls of wisdom I would offer to future dietetic interns and recent grads is we could be anything we want to be. We have the core skills, we just need to actually, kind of elbow our way to the tables outside of the traditional perception that, oh, a dietitian is just food and nutrition and let's keep that person in the kitchen or whatever. And yet, the skills are very transferable. We have to find our voice and understand that we are experts in food nutrition, but we also come armed with, community health, organizational development, community engagement, evaluation skills, social marketing skills, health promotion skills that can be applied across different, settings, different age groups, and, different health topics.